right, welcome to tonight's presentation on a new way to transform your career as a dentist. That is to go painless with Airway Facial Epigenetics. This will help you grow jaws, airway, and revenues. So I'm really delighted to share this exciting, revolutionary advance with you. All right. What's in this for you tonight? First of all, thank you for showing up. I hope to show you a new way to elevate your healing power as a dentist turned mouth doctor and raise your brand and reputation and skyrocket your revenues and career joy. How about that? Okay, so here we go. This is what Airway Facial Epigenetics is. This is totally free of shots, drills, pills, surgery, screws. The tools of the trade for conventional dentistry. I'm not knocking conventional dentistry, don't get me wrong. I'm just showing you a new way to be a dentist, to relate to your patients differently. Okay, so let me start out by asking you this question. Can you produce 100% more without killing yourself as a conventional dentist? Like the one on the left here. This is hard work, okay? This is easy work. This is joyous work on the right, okay? That's how I practice as a airway mouth doctor. So I will tell you what that is shortly. So, what do airway mouth doctors do? Well, we diagnose and treat oversized tongues and undersized jaws, right? We solve dental and systemic issues from choked airway. On the CT scan, it looks like this, right? How does the airway become obstructed, right? And why? Well, I hope to answer this as we go along in the next 50 minutes or so. All right. So I want you to know what an impaired mouth is, okay? A structurally impaired mouth looks like this, right? And every office got crowded teeth that walks out of their office untouched. I'm not saying that you should do orthodontics on everybody, okay? Every office has got teeth grinding. I'm not saying that you should do anything on anyone, but I do think that we should know how to connect the dots in our heads and explain it to the patients. Once you do, you become a powerful healer, okay? Because patients really want the solution, okay? So just take a quick inventory. How many of these cases do you have in your office already? All right. These are endless indications to be of service for your patients. Don't just look for a cavity to drill or a hole to screw implants in. So an AMD is short for an airway mouth doctor. My patients tell me that, hey, you need to have a different label. You're not a typical dentist. All right. So that's the patient suggestion. So what's an AMD? It's one with a unique skill set to diagnose and treat impaired mouth, which I'm going to share with you tonight. And you will be able to treat impaired mouth once you diagnose that with painless airway facial epigenetic method. You can regrow jaws and with it the airway, bring out best face, and relaunch your vitality yourself. Okay? So this is not taught in dental schools or CE courses. I can tell you from my the books that I published, and I publish so many only because there's so many stories to tell. All right. Impaired mouth is behind 80% of all health troubles. Right. So the Chinese says that disease entered by mouth, that they know what they were talking about, okay? And disaster also exits by mouth. But let's focus on the mouth structure as a resident issue that your body has to deal with. Okay. And my message to you tonight is that you as a dentist can fix more than teeth. You can fill a greater need as an AMD, as I'm going to show you. Okay. This means that you have a revolutionary new career path. You will offer painless solutions to deliver best face with top health by mouth. Okay, that is a exciting prospect. So sit back, relax, and let me take you on a rooftop tour. Instead of scratching with the chicken, we'll take the rooftop route, okay? All right, so here is Dr. Susan Kane. She came with a bunch of issues, which you'll find out shortly, but this is her mouth and her teeth and her face, right? Really nicely done veneers, and yet she lives with pain, fatigue, GERD, sugar cravings. So as an engineer who got admitted into dental school, my question is always, why? Right? Why are there these symptoms? Well, long story short, we put her through the epigenetics, okay, by changing oral environment and oral behavior, okay? That is not drill and fill. That is a painless solution for better health, okay? We'll get into a deeper dive on this shortly. We didn't just put any appliance in there. We designed our appliance by doing this kind of analysis called 3D jaw diagnostics. We found out that her 3-foot cage is squashed vertically, 10 millimeters, and her maxilla is too narrow for her mandible. The foot is too big for the shoe. Okay, so the lower is the foot, the upper is the shoe. Now, she's got a problem. Her body does. This is what epigenetics does. Same veneers. We didn't change anything, okay? And yet we can change a whole person's face and the symptomatology, okay? So this is a subjective units of distress, a research tool. It's validated. It's called SUD scale, okay? So 0 to 10, 10 being the highest disturbance, 0 means it's all gone. I don't feel anything. So here's Dr. Kane's pre-treatment symptoms, okay? Pain, acid reflux, mid-sleep wake up, nightmares, sugar cravings in the afternoon, pain, flexibility, and fatigue. Notice in 9 months, everything across the board improved. Everything. Not just dental, not just medical, not just mental, not just pain. Everything. Okay, so in 9 months, her total SUD went from 70 to 11. It's an improvement of 59. Divide 59 to 70, you get 84%. Now, how many doctors, therapists, drugs, or shots or drills would she have to do? And yet, she ends up with a younger looking face, right? And so look carefully, the posterior teeth were not tipped out, buckling. There's no recession, all right? This is what happens with epigenetics, okay? So here we have definition of an impaired mouth syndrome, right? And impaired mouth leads to many medical, dental, and mental symptoms, right? And what's a syndrome? A set of symptoms associated with impaired mouth. Now the question is, how do you treat it? Well, we can treat it without shots, without drills, without the typical tools of the trade in dentistry. With this as a result, okay? And so This is a typical case fee in my office. We charge by the degree of case complexity. 1 to 3 times, 1.5 to 3 times the local orthodontics case fee. Okay, so this is fairly average on an average case. Believe it or not, your patients are really looking to buy. The only real question is, will you rescue them as an AMD? Well, Dr. Susan came, took the training, and here's the result she got. She worked only 1 day a week as an airway mouth doctor in a holistic office. She spent the other time working in a corporate office. And 1 day a week, okay, she got 97% acceptance to start treatment. 97% acceptance to start treatment, okay? 100% they were mentored. That's how I know she had these many cases. And she told me that on average, they charge $8,900 a case outside insurance. They don't accept insurance in that office where she works as an AMD. So here's my first point to you. Patients want painless solutions, okay? I just got this text from her today. Just got her text this morning, 10 o'clock. Well, last night. I don't know how you do it. Look at my schedule next week. Oh my God. A few more cases to get to you too, Commander. I'm so busy. Well, once a patient knows, they are readier than you, the dentist, okay, for epigenetic solutions. So that's why we're putting on this webinar, to share with you the kind of cases you can solve, to show you the kind of results you can get, and the kind of pleasure and joy you can derive from being an airway mouth doctor. 90% of your patients are waiting for rescues, for the rescue from an AMD. The question is, will you be their rescuer? Okay. This is the old paradigm. This is the new paradigm. No shots, no drills, no pills, no surgery, no screws, no braces. Okay, so AMD training, I'm the director and founder, and we train expert mouth doctors. We don't turn out appliance pushers. A big difference between AMD training, and I know many of you have taken a lot of other courses. I'm telling you, I can definitely stand behind all of these that are listed here and more. I just limited to 7 because fire hose kicks in, all right? But sit back and relax and don't worry too much. I'm going to give you access to AMD special at the end of the presentation. So let me tell you my origin story. When I got to dental school as an engineer, I was puzzled and fascinated by teeth grinding. I mean, why would the body destroy the hardest tissue it has, right? And it's not just one patient. It's not occasional patient. It's everywhere. And I asked my professors, well, what's the solution? Night guard. What? That's just a different surface to grind on, right? What happened to the root cause? Well, night guard definitely fails the root cause test. And after I started practicing, you see the effect, the aftermath, the tragedies of not knowing why, not connecting the dots for the patient, okay? Here, you have to say this is a compliant patient. She did everything the dentist said. And look what she had. Can't eat, can't breathe at the same time, right? She couldn't take a full breath, had to quit soccer in high school and college. And she woke up tired 5 days a week, slow starter, procrastination, daytime sleepiness. Here's the best part. Teeth grinding, sleep with a night guard. Her dentist says, nothing could be done. You're stuck with it. Well, I'm sorry, time has changed. I put this photo here to show you that herein lies the clue on why all this is such a mess, all right? The dentist is very proud for having done these implants, but the patient is miserable. All right, so is that successful implant dentistry? I question that. So we'll come back to visit this why shortly, toward the second half of the presentation. But first, I want to walk you through the seminal case, okay, that taught me a lot. And actually opened my eyes to Airway facial epigenetics eventually. Okay, so this is Riley, pre-treatment. She came to me 4 years after braces came off. And here is Riley 3 years after Airway facial epigenetics. We didn't use any night guard. We didn't use any braces. She came to me because she ground through her night guard. Her orthodontist had given her that. And I look at this and I thought, wow, what a relapse, right? Why is there such a huge anterior open bite? Well, as an engineer, I always think about forces. What force is acting on the teeth? Well, it turns out it's the tongue, right? But the question next is what? Why is the tongue doing this? Well, it's for very good reason. Okay, the tongue is actually a respiratory organ now, and the autonomic nervous system is desperately doing its best to keep the airway open. That's why the tongue is trying to fight its way out of Alcatraz. All right, I told her, look, if we can get your lip seal, breathe through your nose, if we can make your upper and lower jaw more suitable home office for your tongue, we can grow you a new face. She said, there is such a thing? Let's go. So here's what we did. This is called 3D jaw diagnostics. It's my GPS for knowing what to treat and how to treat. This is her, Riley. This is her airway pre-treatment. And what are we going to treat? Well, you have to know what's off, where, and how much. And this is called Sassoon cephalometric analysis. And I know her maxilla is retreated 8 millimeters. And on top of that, her mandible is retreated 4 millimeters. And that's why her airway is choked off. Now we know what to do. Grow the maxilla. And the mandible will follow. And that's what we did. The other thing we do is maxilla is the shoe, the mandible is the foot, and guess what happens? The shoe is too small for the foot. So what do we have to do? Grow the maxilla. And yes, I learned this before I learned about airway from Dr. J. Gerber, who taught 40 years of orthodontics to general dentists as a general dentist. Right. And I told Riley and her mom about Dr. Singh, who found that sleep apnea patients' maxilla is only 7 to 10% narrower. Great contribution, my mentor, my inspiration. He also showed that you can use a maxillary appliance and grow the airway by 58%. And now the patient is no longer a high AHI severe sleep apnea patient. I saw that, I said, wow, I'm in. Show me how to do that. I want in 100%. Then I discovered this definition from CDC about epigenetics. It's the study of how two things affect how genes work: behavior and environment. So I combined all the above, okay? And I added a bone building diet as a change in oral behavior to support this change in oral environment using the appliances. And guess what happened to Riley? She blossomed, right? Like a flower, like a fruit tree. And underneath that, her airway tripled in volume. When on the color scale, everything, when you move from left to right, the airway widens. In this case, 7.7 to 24 cc is more than 3 times. So, with the help of Dr. Singh, we published this article on the resolution of sleep bruxism using his appliance at that time. And I want to call your attention to this highlighted part. Sleep bruxism is centrally regulated, that means in the brain, and the highest risk factor associated with sleep bruxism is obstructive sleep apnea. Whoa, that means what? When you ignore teeth grinding, you only put in a night guard, you're ignoring OSA, either in yourself or for your patient, okay? So here's what happened to Riley later. She became a part-time model, okay? Because when you get the maxilla right, the rest of the body will straighten. We don't have enough time to go into that, but trust me, that's the case. Okay, now, it's not the night guard that did this. We would not get this resolved if we followed the same old answers that our professor gave us in dental school in order to pass the national boards. It's time to think on the patient's behalf. So what happened between here and here? I wanted to know if there's a way where we could extract a understanding, a process to help make this kind of transformation for all patients who are suffering from impaired mouth, right? So I liken this face to be a garden whose garden hose is being stepped on. And so the garden didn't go to full bloom. Here, the foot got taken off, the garden hose, and gene expression, genes want to express, by the way. Just like when you get off a cramped airplane seat, you want to stretch, the genes want to go to full expression. So given a chance, okay, by addressing the factors that stepped on the garden hose, you can make a face blossom. And that's true regardless of age, gender. It's true as long as you have natural teeth, sound natural teeth that's not inflamed or infected. When you widen the maxilla, guess what? The sinus also resolves. And here's a great CT slice because here's the same patient. Here is the teeth. Not only did the sinus improved, okay, but look at the posterior teeth. It did not tip out buccally. Okay, so how is that possible? Because the body is growing itself through gene expression, through what we do here, okay? This. Patient loves it because what? The drilling is done outside the mouth, okay? Here, well, we've all been on the receiving end of that, okay? It's also hard on the doctor. My office manager and I are just commenting to each other. We love our job, okay? So, because all the patients come back looking younger and happier. So we have a new paradigm. Teeth grinding stems from choked airway. This is Riley's, okay? And that's Riley's. Night guard is an outdated Band-Aid at best. It's really to soothe the dentist's conscience. Oh, we can check that box because I did something. No, you're missing the root cause. The root cause is an airway. And the airway really is driven by the jaws, as I'll explain to you shortly. Okay, so this has huge implications in your restorative practice as a general dentist. I mean, what happened here? Why was the natural tooth lost? Why was the implant needed? And why did the bone fail? If you don't treat the why, guess what? The patient is going to call you back less and less happy. Here's a patient who is a nurse. One thing about nurses, they're just like hygienists, excellent at executing and implementing the doctor's orders. She did everything the dentist said, including implants, root canals, and nearly full mouth reconstruction. And yet this bridge failed the third time. I got called in. Said, can you help us with this? Well, I took one look and look at this airway here. So there's a study that shows that implant failure is 13% in bruxers and 4.6% in non-bruxers. One doctor, 12,000 implants. The hazard ratio is 3.3. That means your implants is 3.3 times more likely to fail if the patient is bruxing versus not. Well, there's a lot of implants at risk here because those implants exist in this airway. That's why this is home. So airway rules. Airway rules over general dentistry, ladies and gentlemen. And when you go to sleep on this, with this airway, you are going to end up with adrenal depletion, all right? And here I listed the top 10 most common symptoms of adrenal depletion. You can go to bat for your patients. Help them with all of this, not as a medical doctor. You can stay within your scope of practice and solve this problem and improve all of this. Okay, so now let's go back to that poor patient, Anna, right? With a proud implant dentist and a miserable patient. Now we can see why, okay? She has an airway like this. She has a maxilla and a mandible. They're both too narrow. Why? Because she had 4 teeth taken out for braces. And nobody pays attention to this, and she bruxed until she had no teeth left. So are implants an answer? Yeah, a partial answer, but it fails the root cause test, right? So this is a problem because of this, and this exists because of this. You can't treat what your minds can't see. Dr. Rich Beisel, bless his heart, was one of my mentors who has since passed on. But his lesson stays with me, right? You always, always, always try to figure out the why before you treat. So the turning point for me is this realization that impaired mouth leads to a syndrome of many symptoms, all right? Let's look at Anna's symptoms, all right? Can't take a full breath, okay? Wake up tired, procrastination, daytime sleepiness, all right? Everybody didn't just have a choked airway and bruxing. They have a whole lot more, okay? So tiny airway is about underdeveloped jaws. So let's stop looking at just teeth, ladies and gentlemen. All right, airway comes before implant and cosmetic dentistry. If you don't want the patient to come back unhappy. Airway comes before braces. All right, impaired mouth is the root cause. And airway facial epigenetics can restore the impaired mouth. And it's painless. It doesn't get better than that. Okay, so always ask, why is this tree bent? Okay, which way is the forces coming from? All right, why is the mouth impaired and what causes that? Here's a medical doctor. okay, as a dental patient, bought herself a gorgeous set of teeth from an outstanding tooth doctor, all right, because she had GERD, acid reflux, really bad, and it was so sensitive that she had to do something, and that's what she got. After all of that, she still had terrible pain. And after that, she got talked into jaw surgery, okay? And it was because jaw surgery failed that she came to see me, looked me up. So pre-treatment, she had chronic migraine, anxiety, and snoring, pain everywhere, and daytime sleepiness, brain fog. She is a highly specialized microsurgeon, makes a lot of money for her hospital, and she had to cut back on her workload because of this. So here it is in 10 months, chronic migraine 10-1, anxiety 8-5, teeth grinding 10-2. Everything got better across the board, everything. I still remember shaking her hand, ice cold, okay? So she had hypothyroid issues, and she's a physician and she's not getting treated, okay? So it's not anybody's fault. It's just the way the system is set up, the way a medical dental education is set up. I had to hack my way out of the jungle for this, okay? So in 4 months' time, by straightening out her impaired mouth, we got 70% improvement, okay? And this is her comment, looking back as a dental patient. There's an epidemic of impaired mouth out there, okay? And patients cannot possibly know about impaired mouth if their doctors don't. That applies to medical doctors and dentists alike. We are really lucky to have a highly evolved physician, Dr. Chen Ruan here. Wave your hand at everybody. Okay, so obviously from this example, you can tell that impaired mouth is new, 2017, okay? Airway facial epigenetics, I just coined this term in 2024. Newton discovered that gravity in 1665 and it eventually led to space travel. Well, let's see what solving this problem could lead to, okay? All right, so the next turning point for me is that Airway, you know, it's the hot topic in dentistry now. Airway is about the jaws, okay? It's the scrunched 3-foot cage, doctor. It's not the teeth. Major distinction. Airway comes before implant dentistry, okay? Impaired mouth is a root cause, right? So let's look at this case. 59-year-old woman, lifelong back pain, and a whole bunch of other symptoms, all right? Well, just because they have crowded teeth doesn't mean anything. It's whether or not the space between the two jaws is enough for the tongue. That's what matters as a vital airway space. And yet Airway facial epigenetics is able to make this much difference in 10 months. And we do the same thing. We do the 3D jaw diagnostics. That's her airway pre-treatment. And her maxilla and mandible were both too narrow. So we did our thing and designed the appliance accordingly, okay? All the appliances may look similar, but in detail, the bells and whistles are different because every case is unique right here, okay? So you need to treat it according to the targets discovered by 3D jaw diagnostics. You cannot just throw one of these in every mouth. So we put her on this program, and here's what she said 10 months later, right? She lives in Toronto, winters in Florida, and my office outside DC was just one stop along the way. So it was at her convenience that she dropped in. And when I saw her in my waiting room, I thought, wow, do I know this patient? She looks so different. And in fact, Airway Facial Epigenetics also changed her lifelong symptoms. Nausea went from 10 to 1. Poor sleep, 10 to 5. Very hot flash, 10 to 7. Gastroparesis, burping like a sailor, 10 to 1. Okay? You look at all of these, and how many different doctors would you need to see? How many pills take? Right? And yet we did that without shots, without using any of the typical tools of the trade. I call that disease care 1.0. And the patients really want to buy the solutions that is healthcare 2.0. We came up with this distinction between Dr. Ruan and I last month, okay? So we need a different type of dentist, all right? Traditional dentist, I'm not putting anybody down. I was a card-carrying ADA member at one point, okay? I'm an AGD member, okay? So dentists fix troubled teeth because historically, that's how dental schools education told us to do. Airway mouth doctors fix impaired mouth, okay? And we focus on using the mouth and epigenetics to heal a lot of the medical, dental, and mood symptoms. So how many of you have head, neck, shoulder, back pain? Well, I have news for you. It's because when you were growing up, no doctor or dentist was trained in impaired mouth syndrome recognition. I mean, when I see this, I knew really right away. We got a problem here, we need to intervene, right? No. I had to hack my way out of the jungle because this is so new. I'm not saying that anybody's at fault. I'm just saying that the state of the art just went from the earth is flat to the earth is round. We just entered a digital age from the dark ages in dentistry, if you will. Okay, so here's a patient, poor thing. She had one dentist touch one tooth. And 10 years later, she showed up in my in one of my seminars with this pain under her clavicle. One tooth. And she had to sell her house to pay off $100,000 worth of dental bills. Right. And she reported the next morning, I have no pain last night. Okay. So here is a quick video. Look at her face the next morning. All right. There is that much possibility for you to heal your patients. These patients are desperate for answers, and they have been mistreated because of not knowing whatever reason, okay? Oodles of patients are waiting for your rescue. I don't know about you. I'm the kind of guy who likes to go to bed in the bottom of ninth inning, 2 outs, and we're trailing. If you're like that, this is for you. And I will tell you that if you like your adrenaline fill, there is no judgment here. But you can see that your practice is going to, new AMD practice will be built on life-changing results. And at this price, it's very low and very reasonable. And your patients and income will chase you instead of you looking for work to do on the patients. So let me ask you this. What percentage of your patients have impaired mouth syndrome? What percentage of your patients show signs and symptoms of teeth grinding? What percentage of your patients have clicking jaw joints? What percentage of your patients don't sleep well? Or they have daytime sleepiness, right? Okay, so back to that opening question. Can you produce 100% more, double your production without killing yourself? This is Dr. Michael B. Smith in Chicago. right? He has advice for you later, okay? In fact, you saw his comments in the registration page. Heal thyself first as an airway path doctor, just like Dr. Susan King did. So how much is your airway worth, ladies and gentlemen? This is my own case. Pre-treatment, I was in trouble. Post-treatment, I am all clear. Okay, so your choice. Stay true and fail or expand your practice. Just to close out the topic on teeth grinding, here's a case that I mentored. Straight white teeth, gorgeous, right? And yet the patient came in with all these symptoms: poor sleep, aches and pains, chronic skin issues, candida infections in the groin, acid erosion, abfraction, recession, right? He grinds and clenches in sleep. And guess what? This orthodontics relapse. How do you explain all this? Well, impaired mouth syndrome. I won't go through the whole thing. I'll just tell you the outcome. This is Dr. Jessica's patient. This was just this year. And his sleep apnea went from 10 to 0 using the scale 0 to 10. Teeth grinding 0. Crowded teeth 0. So tired and anxiety 10 to 1. Chronic pain 10 to 4. All right, so he improved 90% just from having the impaired mouth diagnosed and epigenetic treatment. All right, so there's great career satisfaction and there's incomparable value. Remember I talked about the 7 differentiators? Well, the 7th one is incomparable value. How much is that cake worth? How much is your airway worth? It's priceless. How much is a single tooth worth? They did a radio call-in survey. I want your central incisor. The DJ says, I'm an Arab oil sheik. I have all the money in the world. I want your central incisor. How much would you trade? Give me your tooth, name your price. This was in the 90s. Average is just under $1 million, okay? The average call-in value in the eyes of the patients. All right, so here is return on investment. This is Dr. Jeff Yelling. I'll let him do the talking.
So it's not like I'm the only one treating airway.
Right.
And so I think that needs to be complemented because we've had incredible success. Like, I mean, there's been times when I'm just like, I can't take on any more cases. I can't, we just don't have the time. Brittany doesn't have the time.
Is this still true, Dr. Jeff? Since you have the mic now.
Yeah.
Is it still true? By far the highest ROI you ever implemented.
Yeah, definitely. Yeah.
Okay, by far the highest ROIs you ever implemented, okay? That's because he took his staff to AMD training, and Brittany is a first-class airway treatment coordinator, okay? This is one of the best practices you can implement as an AMD. She has her own column. She handles all the diagnostic records. She is the liaison between Dr. Jeff and myself. She is educating patients. She's coaching them on getting to, yes, she connects all the dots for them, okay? And so she's a revenue generator in his office. So this brings me to mentoring. We have the best in class mentoring. This is Dr. Lena Alexander's patient, okay? You too can do this, all right? And I'll let her speak.
I give the doctor permission to use my testimony. And
all right, so
Tell us a couple of things that were going on before you first met Dr. Alexander.
So I was not sleeping. I couldn't eat. I started developing liver problems to where I couldn't digest anything because I had severe anemia. And that progressed into my oxygen levels going down. I was being depleted from nutrients. And I couldn't even go to the year worth of exercise went down to I couldn't even go to the gym anymore. I used to go every day. And then yeah,
Okay, and then it's been 1 year since you've been wearing the appliance, and how has it helped you?
I've been able to go to the gym and I'm eating better. I'm not puking up my food. I can breathe. My heart rate has
A lot better.
yeah, gotten a lot better. It used to stay at 130 while just sitting down, and now I have a resting heart rate of 66 beats per minute most of the time.
Oh, that's
So it's
awesome.
normalized
Yeah.
and yeah, and
Okay.
I've been able to sleep, breathe, eat better. I have no anemic symptoms,
Mhm.
and it's
Oh,
been
that's
pretty
awesome.
great.
That's awesome. Really
Yeah.
good to hear that.
You can do this. All right. These patients are everywhere and they want to buy answers. You just have to provide it. Okay. And guess what? This is my armamentarium. You do need a CT. Okay. But this is what happens when I see patients. This is what I use. I spend most of the time taking photographs so I can teach and spread the word. Okay. I couldn't bend a wire in dental school, but I use these now, just simply a tweak of the wrist, and that's all that I need to do. And the engineer in me can do that, okay? So this is an airway improvement, okay? Went from 134 square millimeter minimal cross-sectional area to 307, ladies and gentlemen. That's 2.5x, okay? This is one of my mentees, Dr. Doris Perez, okay? You can do this, okay? And we're here with you. She brought her entire staff and she was really excited. She said 2 months later, 4 weeks later, she said, we got huge collection day from 4 mentor cases. They all came in, patient says, let's start. We want to go, okay? So let's get to the airway obstruction. Why there is so much impaired mouth syndrome. Well, now we know why. This is maxilla. I tell the patients and the dentists who train with me, year to year, between the corner of the eyes, corner of the mouth, year to year is your maxilla. That includes the cheekbone, okay? And the middle third of the face, such as what you see in this image right here, the middle third of the face, it's formed by this, and the surface of the face has the maxilla as a foundation, right? So what you see on mid-face is really the result of how well the maxilla grew when you were a teenager. Here comes the next turning point. Okay, anytime you see a small airway or airway obstruction, it's about the jaws, not the teeth. Okay, it's the scrunched 3-foot cage. It's not the teeth. The tongue needs space. That space is framed by maxilla and mandible. All right. And in 90% of all dental, medical, and mental patients, there's an impaired mouth undiagnosed. It's a root cause of huge set of symptoms. But here's the great news. We can regrow with airway epigenetics and it's painless, okay? So we have mentors who are standing by and I want to invite them to chime in. Identify yourselves, unmute yourself and talk about your experience on how patients and parents are eager to buy, even outside insurance. Dr. Lewis.
Yes, hello.
This is Dr. Lewis here.
Yeah,
She
I can just
spent-
tell you.
I want to just say one thing. Yeah, allow me. She spent her birthday in my class. Okay, that's how dedicated she was. All right. Way back in 2018. Now go ahead.
Yeah, that's when I
Yeah,
started my
yeah.
training, and it's life changing. I did the treatment on myself. I've had a lot of patients now. We probably see anywhere from 10 to 20 3D jaw diagnostics a month, and probably convert 5 to 10 of those a month into treatment. So, and we always keep hearing, how come nobody else does this? How come nobody else is telling me this? And it will gain momentum. And it's just, once you start learning this and see it, you can't unsee it. And then your team gets excited and they want to know more and learn more. And so it's I can't say enough great things about it. And I love what I do. I love helping people, and I feel like it's finally something you're truly changing people's lives with.
Thank you. Any other AMDs here? Unmute yourself, raise your hand. Dr. Nimi?
Hi, Dr. Felix. Hi, Dr.
Hey.
Chang. Hi, Dr. Christine. Yes.
I want to say Dr. Nimi spent her 30th wedding anniversary in my class with her family. How's that for dedication, huh?
It is. Well, it's the best anniversary celebration ever.
Well, we're going to show her daughter's case next. So go ahead and tell us your experience with patients, please.
Oh, it's been wonderful. I mean, just to be able to, get and able to help them if they come to you with a toothache, but it's really not a toothache, it's more than a toothache. And when you give them answers and you are able to help them out from that pain, it's just an unbelievable feeling, Dr. Felix. You know what I'm saying? Like, it's the satisfactions of being a doctor. And I always say this to everybody. As a doctor, it comes from a Latin word, docere, right? We should be teaching our patients. And what a wonderful way to teach them that the mouth is such a big part in the whole health. So,
Yes.
yep. And I'm 5 to 10 patients for Dr. Christine. So, I guess there's going to be more competitions here, right, Dr. Christine?
Yeah, well, once the patients know, there's going to be a sea change. All right, so I want to show you this thing here. So this is Dr. Nimi's daughter, okay? And she got started with Dr. Nimi telling the orthodontist to take off the braces on her daughter, Zion. The orthodontist says, you can't do that. All her classmates are having braces done. Well, Dr. Nimi says, I know different. There's this thing called epigenetics. I want to put my daughters on that. So this is 10 months later, using the bone building diet and the epigenetic appliance. Here's what happens in about a year and a half or 2 years. Okay. She won the national speech and debate championship for homeschool kids because her airway improved so much. And she got a free full scholarship through college. All right. So great job, Dr. Nimi. As a mom, she made the right call. Epigenetics did not create any problems. In fact, solves a lot of the problems. We don't have time to take a deep dive into the clinical side of this case, but I want to just show you what happens when you have impaired mouth straightened out early on in your children. So I can safely say that we have cracked the epigenetics code. All right, your child no longer has to end up like this. In fact, every child has the potential to become a lead actor or a lead actress. What's the difference between these two faces? Right? It determined their career. All right, this one's limited to character roles. Like we need a witch, you would cast her, right? Well, what does she not have that she has? Well, we know the answer now. Okay, here comes the most consequential sleep research out of Stanford, the world's premier sleep research center. Pediatric obstructive sleep apnea is a disorder of oral facial growth. Well, who is trained to take charge of oral facial growth, ladies and gentlemen? No one so far, but it will be AMDs and doctors, physicians who know about AMDs and work with them. So here's my granddaughter, Camilla. When my son told me about her and asked about how to raise the healthiest kid, well, I said, we got to write a book on just that topic, okay? And this is Dr. Maria Dwyer, Bismarck, North Dakota. She sold 51 cases in 2 months after she took my training, just because of this, okay? She's the mom of a holistic moms network there locally, and they went all in, right? 51 cases in 2 months. I think that's still the top record, okay? So we gave Camilla these things to chew instead of plastic mild munchies, okay? This is Camilla's mild munchie. This is her dad. And I reached out to him when I finished writing this book. I said, I have a problem. Well, I don't have a problem, but patients have a problem. They don't know what to eat or how to cook. Well, Franklin does. This is my son. This is Dr. Ruan. And this is what happens when Franklin does 90% of the home cooking for Camilla. It's not like she's deprived, right? Here's a chocolate cupcake here, all right? When I take her out, we still have hot chocolates with whipped cream all over it, her lip, okay? This is what she looks like. You don't need an appliance, okay? How did nature get us here? All right? It's the genes expressing. Take the foot off the garden hose, right? Help nature express the genes. So to that end, Dr. Ruan and my son, Chef Franklin here is teamed up to help this cause. So Dr. Ruan, you want to mention this for everybody's benefit?
I'm trying to not interrupt you through all this.
Coming to an end here. We're less than 10 slides away.
Well, you know, one of the great things about being an MD and a physician, especially in functional medicine, is that we try to look at the root cause of different things. And oftentimes we get to a roadblock, and every time it's been airway. Every time it's been airway. And so now we no longer have roadblocks, so much so that we refer, I think Jillian's on this Zoom as well. She's our outreach coordinator. So she coordinates all our dental and medical operational fluidity workflow referrals. Hey, Jillian. And she, what we always try to train our patients is we got to eat right. We do mind body medicine, breath work, mindfulness, Tai Chi Qigong, meditation. But a lot of times if your airway is restricted from a physical standpoint, like you can only go so far with your health. So I know, Felix, you can't say diagnosis, but I'm an MD, so I'll say diagnosis. So we always look at airway for ADD, ADHD, Parkinson's is huge. Every Parkinson's person pretty much has airway issues. Another thing that's disguised in the field of something called Potson's dysautonomia. Potson's dysautonomia is actually impaired mouse syndrome that's really severe. The peripheral neuropathy. it really bugs me that whenever neurologists, diagnose peripheral neuropathy, put on medication. Well, a big part of peripheral neuropathy is nitric oxide downregulation from impaired mouth syndrome, mold toxicity, mast cell activation syndrome, histamine. These are all from impaired mouth syndrome as well. And so there's a lot of things, and adrenal fatigue. Like every time I hear adrenal fatigue, I'm looking at their mouth. So thanks to Dr. Liao. And I think that because of this, Jim, I just counted last month, we referred to dentists 197 times to dentists in our organization.
We
Yeah.
need professional education.
197, yeah. And so this means that a lot of times we're picking up on things from a medical standpoint, and we require our dental friends, especially with Airway dentists, to really help us out. And then of course, Felix, thank you for my sister. I just followed her just now. So my sister, she's an MD, she's interventional radiology, NYU. She can't believe what she's feeling right now as well. My sister has sleep apnea and narcolepsy. And her narcolepsy is significantly better. She's only on day 3 on the appliance, by the way. I'm actually pretty shocked myself. I was really skeptical that this is even gonna work that well for her, because she's tried other appliances and stuff in the past, and this hasn't really worked well. And so thank you, Dr. Liao, for my sister's success as well. Yeah.
So tell about this January 4th event. This is really exciting. This is proactive medicine at its finest, ladies.
Yeah, so this is the January 4th event. Annabelle, you want to come over here and say hi real quick? So this is my daughter Annabelle. She's 10 years old.
Hi.
Annabelle.
Yeah, not too long ago, she was diagnosed with a pancreatic tumor, and she had to have a 6.5-hour surgery to remove. She's doing great now.
2 months ago.
Yeah, 2 months ago. So this is sort of our celebration of getting together. So her picture's on the left with my 2 other daughters. And then Chef Franklin, our son. We decided to create this thing called Growing Happy and Healthy and Happy Children. And a big part of it is understanding that connecting ourselves relationship through our food, our emotions, our experiences is a big part of what we're supposed to do as humans. And Annabelle's written a whole agenda for the field day.
I'm still organizing it.
Still organizing it?
I still like to say something.
You like to say something? Okay, Annabelle.
Yeah, about like the food and emotions and stuff.
Please do.
I normally like wake up like really grumpy in the morning, and then what normally makes me like turn into my optimistic self is food. Because once I eat in the morning, you'll see me smiling all day, and yeah. Which is why I was also so silent at the hospital, because I was just in PO for so long.
NPO, yeah.
I couldn't eat. Not feeling myself.
Yeah. So yeah, we're doing a whole a day. It's a field day, and we have cooking planned, and then also talking about like impaired mouth and how it contributes to picky eating, how it contributes to ADD, and it's going to be a big celebration of just life in general. So that's what the January 4th is all about.
Thank you. Looking forward to it. Okay, so let's finish this up. If you want to elevate your healing power and elevate your brand, Google advertising is not the way to go. The way to go is to treat root causes to solve problems for your patients, okay? You treat root causes, and you don't just patch up a sensitive tooth with bonding agents, all right? So I will tell you that the mouth contributes to 80% of patients' dental complaints, all patients, medical, dental, mental. And that's a conservative estimate. And you now have a painless solution. So an AMD is an unrivaled wellness resource in the community. You just saw how an evolved physician like Dr. Ruan did with the referral, 197 referrals in 1 month. Okay, that's intelligence at work. That's problem solving. Okay, so when you applied to dental school and got out of dental school, did you aspire to be a tooth carpenter, or do you aspire to more? Okay, you now have an opportunity to take the training, and I invite you to a 2-day immersion where would relaunch your vitality, will heal the healer and the chief producer for your practice. We'll teach you how to work up impairment mouth syndrome and apply airway facial epigenetics that is all natural, helping people get to full genetic potential. That's painless. And you don't have to bend over patients anymore. You get high joy and low stress. It's real, right? So we'll cover all of this, and you'll get three cases covered with mentoring. Okay, so in other words, if you take full training, this is like the first baby step. When you take on full training, you'll get 3 cases covered, mentored, and therefore it will cover your tuition. I didn't say that too well. 3 cases mentored, and the income from those 3 cases will more than cover your tuition. Okay. And again, I ask, how much is your airway worth? Right. And what's in it for you? It's evidence-based science and system that's tried and true. Hands-on training so that you can acquire the new AMD skill set and you can unlock your full potential as a healer. And best of all, for the next 2 classes, I will personally take your construction bite. This is taken. Wrong typing there. I'll personally take your construction bite so that you can start your own healing journey. And you will be able to submit after you take this first baby step of 2-day immersion. So you can submit your head scratcher cases for me to coach you on that. All right. So we have 2 courses coming up. One in Tyson's in January. That's outside Washington, D.C. And we have Honolulu in February. And I believe we just added at the end of January, Houston. So I invite you to call this number. This is Joe Womack, who has got a wealth of experience and wisdom in airway and oral appliances. Joe, say hello to everybody, please.
Hello, everybody. Hello to everybody. Yeah, I've been fascinated from this healing since I met Dr. Singh, and he explained he explained the spatial matrix hypothesis from the University of Michigan in 2002 that he worked on. But I've seen nobody really turn dentists into airway mouth healers, into airway mouth doctors, and make it productive and make it financially viable. So that's why I'm excited about coming along, Dr. Felix, and seeing what I can do to help facilitate and make sure you guys can get your questions answered in a timely basis.
Yeah. So this is not more of the same. This is actually revolutionary. So we want everybody to have access to this. That's why we are spreading out all over the country in key areas. And somebody asked about Houston. I will put this up in the chat box right now. Let's see here, chat box. Okay, Houston. It's all because of Dr. Chang and of course Camilla, okay? That you guys are getting this break. Can everybody see that? Those are the first two. Now, the next two, you either go to Virginia or Honolulu, your pick. That way, not everybody has to fly all the way across the country. We meet each other.
Felix, are you sharing your screen or something? I don't see where you're pointing to.
Chat box.
Oh, okay.
Okay, so I'm not sharing the screen anymore. We have
Felix, it's not in the chat box.
really?
Yeah. I promise. There it is.
Oh, that
There it is. It's going through now.
I need to click the arrow. Okay.
Yeah.
Okay. So again, here's the number to call, and Joe will answer. He's got a wealth of experience, and he's the nicest guy, and you cannot go wrong listening to him. That's why we are so glad to have Joe on our team. Now, I'm going to unshare this screen, and you guys can unmute. I invite you to unmute, and feel free to ask any questions you want. This is open mic season. Go. No questions or comments? Feel free to chime in. If you had prior failures, if you had, post-traumatic stress syndrome that says, oh, I don't know if I can trust anybody else anymore. Go ahead, pipe up. Yes, Joe.
Hey, Felix, there is a question in the chat about ATC training work. Do we bring them to the same course we attend, or is there a separate program for that?
The same program. So I recommend all doctors bring their staff at least to the first course. You don't want to leave anybody out. Trust me, when you head back, you don't want blank stares on Monday morning. When you go back, you want everybody going, yeah, we can't wait to get started. And trust me, if you help your staff, they'll become very loyal ambassadors for your practice. It's the best way to build your brand is to have an enthusiastic staff that is 100% on board and loyal, because you heal their impaired mouth syndrome, you heal their husbands, wives, or kids. All right. And so we have a separate in-office training program, but that comes after all the staff had gone through all the 4 series. Yes.
Just real quick, Felix, what percentage of the airway mouth doctors that have successfully enjoyed this journey have either treated themselves or staff? Like it's been a valuable thing to become an airway mouth doctor just personally, hasn't it? Isn't it like at least half of the AMDs treated themselves?
Well, I'll let Dr. Kristen Lewis and Dr. Nimi answer that one. Still there? Dr. Nimi?
Yeah, what was the question again, Joe?
Just, it seems like a high percentage of the real evangelists of the airway mouth doctors I've met actually treated themselves or a close family member, which that is proof is in the pudding. It pays for the journey just with the personal treatment is kind of what I've seen and heard. So I was just asking, is that an exception, or is that typical of you guys who've really been successful at this?
I think it's really typical because first, you tend to really find solutions on your own concerns. Like for me personally, I saw there's a lot of problems seeing my kids growing up. And I myself, as a dentist for so many years, have so many problems that I was also looking for a solution. So I remember the first time I sat in Dr. Felix lecture, when the light bulbs just, kind of lighten up, and I go like, oh my goodness, I have to do something for myself first. And then, I treated my husband and then went with Zion and Elijah, and rest is history. So yes, I think all the AMDs, we pretty much treat ourselves first.
Tell them about Arthur's progress. Arthur is
Well-
Dr. Nimi's husband.
Arthur's progress is very dramatic. So
Yeah.
oh, I'm hoping he's not listening, but I'll be in trouble. But you know, he's a heavy snorer, and you know, as a wife for so many years, it's very scary to, you know, be with somebody that's just really have a very loud snores. Not to mention just the apnea itself. You can really tell that there's a cessation of breathing. And so when Dr. Felix and I decided to, you know, treat him, Dr. Felix designed the appliance and we did the whole health. So I want to regurgitate what Dr. Felix is saying. It's not just the appliance, it's the whole approach. Just like Dr. Cheng is mentioning or have mentioned, it's nutrition, it's the emotion, you know, it's the mental, you know.
Yes.
So we did those things, and I would say actually with Arthur, in 2 weeks, it was really very dramatic. Like I've seen so much improvement. You know, just a different man, I would say, you know. He's not as lazy as I thought he was.
You
So
want to go
yeah,
to sleep with him in the same bed now, right? Not because of the snoring.
absolutely, absolutely. A lot of energy. Yeah, just awesome, Joe.
Yeah.
Thank you.
And one thing I want to add, we don't have time to show all the cases, but the progress comes very fast. So Dr. Ruan mentioned how his sister improved in, you know, overnight, right? It's a different person. So I have patients who go home with the appliance in their mouth and say, well, geez, I can turn my head better now when I'm driving home in traffic. All right, that's important for safety, right? So a lot of the esoteric things like, you know, lifelong nausea goes away. It doesn't take a lifelong to reverse it, okay? Anxiety and depression starts getting better. Pain starts getting better right away. And because the mouth is just so undiagnosed, so missing in everybody's radar. So we thank Dr. Ruan for recognizing that, for starting a movement to effect sea change eventually. And I encourage all of you who are watching this this seminar to make a difference. But simply by spreading the word, making a recommendation or referral, it's enough to change somebody's lives and life quality. Okay, any other questions? Feel free to pipe up. No? Well,
Felix, can I kind of add something just from a physician standpoint?
yeah, it's great.
So I do want to make sure people understand that, like, especially my sister's case, she's been on the CPAP for a long time. And when she's using the appliance, she's actually using it with the CPAP. So there's a lot of people on CPAP and BiPAP. It's not that they can't tolerate it and go to appliance, it's that they can tolerate it just fine, but the quality of life is not improved until the jaw positioning is actually in the optimal position. I think that's a really important thing to really understand. And so whenever we're looking at sleep apnea, it's not about treating the sleep apnea, it's about improving the quality of life, like while they're being treated. And of course, over a long period of time, there's a hope to get off the CPAP for a lot of people, which is great. But I do think it's important to have a very clear distinction that with the things that we're doing right now, you're actually dramatically changing the quality of life, and as quickly really as day one. And which is something that we don't see. And being an MD, and Jillian will tell you this on my team, we get all the airway questions. We get MARPI, SARPI, Vivos. We get jaw surgery cases, right? We see every case, every appliance, ALF, like everything. Like I only recently start to understand and know these names because we get asked everything. But the reason I'm not on other calls and I'm on this one with Dr. Liao is that I think what I see here with the way that this training is done, it's really an entire total body approach that dramatically increases quality of life that other things can't. And so even myself, this is my old appliance. I won't tell you what this is, but it's not going to work. And I think that from a physician standpoint, like trying to get to the root cause has always sort of been the obsession, but I can't do it without my dental partners. So thank you.
You're welcome. Anyone else? And it's so, by the way, this is a real treat to have a physician as enlightened and as caring as Dr. Ruan to come on and share his perspective with us. Dentistry needs a physician partner in every town, every city, across America, around the globe. And we're going to make that happen in the next few years with your help. Thank you. Last call. Going once, going twice. Adios. See you next time. See you in class.